What are the health benefits of ginger tea? What is ginger tea? Ginger is one of the most common ingredients worldwide, used as a spice and medicinal plant. In folk medicine, people often use it to treat coughs and the flu, among other ailments. It has traditionally been used in numerous forms, including fresh, pickled, powdered, dried, candied, preserved, crystallized. Similarly, it is available in multiple forms. Trusted source, such as capsules, tinctures, extracts, tablets, tea. As mentioned above, ginger tea is made by boiling the peeled root in water or milk. The oils and compounds responsible for ginger's characteristic aroma and spicy flavor make up about 1–4%. Trusted source of the ginger root. Two of these compounds, gingerols and shogails. Trusted source, are considered ginger's main bioactive components. This means they are the ones behind most of the health benefits of ginger and ginger tea. Here are just some of the known and potential benefits of ginger tea. Summary: you can make ginger tea by boiling the root in water. It has a sharp and spicy taste. It's rich in gingerols and shogails, the components behind many of its health benefits. Health benefits of drinking ginger tea. Here are 7 potential health benefits of drinking ginger tea. 1. May provide relief from motion sickness. Folk medicine suggests that ginger tea can help calm motion sickness symptoms, like dizziness, vomiting, and cold sweats. One 1988 study. Trusted source: in 80 naval cadets unaccustomed to sailing in heavy seas determined that those who received 1 gram of powdered ginger reported reduced vomiting and cold sweating. Although researchers don't understand exactly how ginger works, some have suggested that certain compounds in ginger block a brain receptor. Trusted source: that has a key role in the vomiting center of the brain. However, current research is limited or inconclusive. Trusted source. Yet, if you experience nausea from time to time, ginger tea may be a good treatment to try. 2. May alleviate nausea from morning sickness or chemotherapy. Some experts believe gingerols in ginger can help relieve nausea caused by pregnancy, chemotherapy, or surgery. Researchers suggest that ginger might be an effective and inexpensive alternative to traditional anti-nausea drugs in people who are pregnant or undergoing chemotherapy. Trusted source: and can't have conventional medicines. One study. Trusted source: in 92 women found that ginger was more effective than a standard drug at preventing postoperative nausea and vomiting caused by general anesthesia. Nevertheless, be sure to check with a healthcare professional before using ginger after surgery. It may interfere with blood clotting. Trusted source: although research on this is still emerging and more is needed to investigate it further. 3. May help manage blood pressure and support heart health. Research suggests that consuming ginger in daily doses of 2 to 6 grams may help protect against heart disease. Trusted source: ginger may do this by lowering blood pressure, helping prevent heart attacks, helping prevent blood clots, relieving heartburn, lowering cholesterol, improving blood circulation. 4. May help manage weight and blood sugar levels. A lot of research shows that consuming ginger has beneficial effects on weight and blood sugar management. Research suggests that ginger may help manage body weight. Trusted source: by increasing thermogenesis, the production of heat by your body, which helps burn fat. Increasing the breakdown of fats for energy. Inhibiting fat storage, inhibiting fat absorption, helping control appetite. In addition, ginger may help improve blood sugar control in people with type 2 diabetes. Trusted source: and obesity. Trusted source: by reducing fasting insulin levels, hemoglobin A1C, and triglycerides. Hemoglobin A1C is an indication of your blood sugar levels over the past 2 to 3 months. 5. May relieve pain and inflammation. People have used ginger to treat inflammation for centuries, and now science backs up this practice for certain uses. Research trusted source shows that the compounds in ginger called gingerol and shogaol help reduce the production of pro-inflammatory markers. People have particularly studied ginger for its effect in relieving pain from osteoarthritis of the knee. Trusted source. Ginger tea may also help alleviate menstrual cramps if you take it at the start of your period. Research shows trusted source it may be equally or more effective than over-the-counter pain relief medications. 6. May have cancer-fighting properties. Studies have even shown that ginger may help prevent cancer. Trusted source, mostly due to its gingerol and shogaol content. Test tube studies have shown that gingerol and shogaol may contribute to ginger's cancer-fighting properties. Trusted source by causing cell death and preventing cancer cell multiplication and growth. Other test tube studies have shown that ginger may affect several different types of cancer cells, including pancreatic, colon, colorectal. Trusted source, ovarian. Trusted source, prostate, and lung cancers. More studies on the effects of ginger and ginger tea on cancer in humans are needed. 7. May protect your brain. Scientists have studied ginger's protective effects against oxidative stress and inflammation, two factors that play a decisive role in the development of brain degenerative diseases. Trusted source, such as Alzheimer's disease. Animal studies. Trusted source show that gingerol and shogaol may offer protection against age-associated decline of brain functions. Trusted source due to their antioxidant properties. Test tube studies also suggest that ginger extract may increase cell survival against beta amyloid, a protein closely related to Alzheimer's disease that can induce toxicity in brain cells. Summary. Compounds such as gingerol and shogaol in ginger may offer beneficial effects for nausea, pain, inflammation, heart health, diabetes, cancer, and brain health. Potential downsides. Drinking ginger tea is unlikely to cause serious side effects. Ginger is generally recognized as safe GRA by the Food and Drug Administration (FDA), including for those who are breastfeeding or chestfeeding. The FDA says it is safe to consume up to 4 grams of ginger daily. However, these amounts are generally not reached in studies. While there is no consensus on a correct dosage for ginger, studies recommend a safe daily dose of 1000 mg. Trusted source of fresh ginger. This is the equivalent of 1 teaspoon, 5 milliliters, of freshly grated ginger extract, 0.4 teaspoons, 2 milliliters, of liquid ginger extract, 4 cups 946 milliliters, of prepackaged ginger tea, or 2 teaspoons 10 milliliters, of ginger syrup. 1 trusted source. Note that ginger tea is likely less concentrated than these forms of ginger. So, while drinking ginger tea may have side effects, you're unlikely to experience them if you drink only 1 or 2 cups. That said, if you think you're experiencing side effects from drinking ginger tea, stop drinking it right away and consider speaking with a healthcare professional about your symptoms. When people do experience side effects from consuming ginger, they most often report gas, bloating, nausea, and heartburn or reflux. Other reported symptoms include diarrhea and abdominal pain. Since ginger may lower blood pressure and may have a blood thinning effect, people on blood thinners or blood pressure medications should consult their healthcare professional before consuming extra ginger. Summary. Some of the most common side effects of drinking large amounts of ginger tea are gas, bloating, heartburn, and nausea. Studies recommend keeping your intake of prepackaged ginger tea under 4 cups per day. How to make ginger tea at home. Here is an easy-to-follow recipe for making your own ginger tea. Ingredients: 4 to 6 thin slices of peeled, raw ginger. For stronger ginger tea, add more slices. 2 cups 473 milliliters water. Juice from half a lime or lemon. Honey or another sweetener, to taste optional. Directions to make it with water. First, wash and scrub ginger root. Then, peel ginger and slice thinly. Fill a medium pot with 2 cups water. Place ginger slices in water and bring to a boil, then simmer 10 to 20 minutes. Simmer longer for spicier tea. Remove from heat. Add lime or lemon juice and honey to taste, if desired. Serve in your favorite mug. Directions to make it with milk. You can also make ginger tea with milk. Boiled ginger root slices in 1 cup 237 milliliters water for 10 minutes. Remove from heat and add 2 cups 473 milliliters milk. Put pot back on stove and gently simmer milk and ginger for 5 minutes. Serve in your favorite mugs. Summary: to make your ginger tea at home, simply boil some ginger slices in water and add lemon juice and honey for flavor. We hope this video is helpful to you, and please subscribe our channel for more videos like this. Turn on notification and share the video with your friends and family.